Thank you again, Commissioners, and our community members who are listening in for the time today to provide you an update. My message today will sound a little like a repeat, but a repeat of really good news. Our local indicators continue to improve as Omicron surge continues to fade. Here's our epi curve starting at the beginning of May, just so you can focus in a little bit more on that latter part where you can clearly see the impact of Omicron, and also as you approach that March 1, how very quickly we've gotten down to a low level. Our case rate has now fallen below 100 and is currently 51 new cases per 100,000 per week. This is down 65% from the last time I presented on March 1st. Our percent positivity continues to decrease and is now 4.7, so we've fallen below the 5%. 2 additional deaths were added to the dashboard this past week, and this is a decline over a plateau for 2 weeks prior. Hospitalizations continue to be low and favorable, with both inpatient beds occupied with COVID-19 and ICU utilization well below our alert levels. Our local metrics seen here are all moving or have already moved into very favorable areas, and so you can see a lot more of the green now. We still have our case rate still in that orange area. When we look at the CDC community level tool, it's still showing Buncombe County in the medium, although I do suspect that we'll see that come down in the next week or so. With current high levels of vaccination and high levels of population immunity, both from vaccination and previous infection, we know that the risk of medically significant disease, hospitalizations, and death from COVID-19 is reduced. At the same time, we know that some people in our communities, such as our elders, people who are immunocompromised, and people with disabilities are still at a higher risk for serious illness. So the COVID-19 community level tool can help communities and individuals make decisions based on those risks. In this medium status, no community or population-wide recommendation, mask recommendations are provided. What is provided is individuals with underlying health conditions. There is a recommendation that they may still want to continue wearing a mask in indoor spaces when a county is in medium. In this medium area, it is still recommended to seek testing if exposed or having symptoms, and to be up to date on vaccines. The community level tool puts emphasis on the burden of COVID-19 within a community by first looking at week over week cases, then places greater emphasis on hospitalizations than the other metrics that we were previously following. And these are precisely the measures that at this phase in the pandemic, we locally have also been moving to. You've heard me say for a few weeks now that our emphasis is going to be around reducing severe illness, hospitalizations, and deaths. So as such, public health will be migrating to the community level tool and sunsetting our local metrics. It just makes sense now to do this because we believe moving to the community tool is aligned with the direction that we've all been moving into since the beginning of 2022, with an emphasis on COVID burden and hospitalization, so that severe illness pieces. So COVID-19 will continue to be a part of our lives going forward. We will use the community level tool to help identify additional precautions based on the level of risk. Additionally, it provides, the community level tool provides a weekly cadence to follow trends, which is much like what we've already been doing locally. And lastly, it reduces confusion to move to one consistent tool versus maintaining 2 tools to assess community and individual risk. So in short, public health will be migrating to the community level tool this week going forward. In addition to shifting our monitoring of local trends to the community level tool, our COVID-19 command team has discussed and recommended that we move to once monthly community briefings beginning April 5th, with decreasing trends, community understanding of recommendations and precautions based on the risk, and that we are demobilizing mass COVID-19 operations and continuing to integrate those into our regular public health operations. It is time to also reduce the frequency of the briefings. Ultimately, we hope to transition to no standing briefings within 1 to 2 cycles, so about 1 to 2 months, but reserve the opportunity to provide more frequent briefings should the COVID-19 situation warrant or the board so requests it. Next up, I did want to give you a summary and a reminder for our community of the vaccine efforts and testing opportunities within our community. So not much has changed in the uptake of vaccine by age group in the last 2 weeks since I saw you all. Vaccines are still increasing, but at a slower pace than previously. In the past week, Buncombe County HHS saw a jump in vaccines administered thanks in part to our equity-focused community outreach, which I'll talk about on the next slide. Overall, 72% of our eligible population has received at least 1 dose, and almost 99,000 third or booster doses have been administered at this time. Third and booster doses continue to be the majority of the doses that Buncombe County HHS administers through our clinic. You all have heard me say many times that we have moved our COVID-19 vaccination clinic into our existing immunization clinic at the health department located at 40 Cox. That occurred on February 21st. The transition has been relatively smooth and working well. Individuals can visit us at the health department to receive the dose that they need, and COVID-19 vaccine is available by walk-in. Last week, we did partner with Healthier Together, YMCA, and the Mexican Consulate to provide vaccinations over the course of 3 days. This event resulted in almost 60 COVID-19 vaccinations being administered and over 30 flu vaccines being administered. So I want to thank all of our partners involved in the planning and implementation and execution of that event, who also provided lots of wraparound information while we were providing vaccine. And as a reminder to our neighbors who are not yet up to date on their vaccines, and with reports indicating from Europe and other places that they are beginning to see a rise in cases, I want to remind folks that if you are missing a dose or have not started your series, now's the time to do that. As you've heard me say before, and as our world sort of shifts into a more endemic approach to our response to COVID-19, it is likely that we will see waves of cases come. And again, just a reminder that as we proceed on this journey from pandemic to more of an endemic state, it doesn't mean that COVID has disappeared. It actually, the very nature of being endemic means it's with us all the time. So just a reminder to folks to stay up to date on your vaccines, and if you have not started your series, please do so. Community testing is still available in Buncombe. If you are having symptoms and have been exposed, you can visit the StarMed website to find a location and time to be tested. Currently, StarMed continues to provide testing at the Asheville Mall and at Harrah's Convention Center. They did discontinue their site at AB Tech on Sundays and Mondays due to low turnout, and that was effective this week. And there are many other testing providers in the community, and you can find them at the North Carolina DHHS Find My Testing Place website, which is listed. I did just want to take a few moments to talk briefly about the Test to Treat program, a new initiative at from the federal administration, and just provide an overview. So the Test to Treat program allows individuals who need to be tested at a site. If they are positive, they then are eligible for treatment and can receive an appropriate prescription from a qualified healthcare provider and have their prescription filled at that site. So it's essentially building a one-stop shop for folks who are positive for COVID-19 and may be eligible or meet criteria for treatment. in some cases, individuals who receive COVID-19 test results through at-home testing or other testing sites can also utilize the test to treat location to receive a prescription from a qualified healthcare provider and treatment on the spot if they're eligible. There are 77 retail pharmacy sites. So the federal administration started this program with their retail pharmacy program. And there are 77 retail pharmacy sites within North Carolina, and 3 are located in Buncombe County. They are listed on there. They are all CVS's. It is expected over the next few weeks that additional locations, including FQHCs and long-term care facilities, will be added to the program. By mid-March, we anticipate that a site locator, so one of those wayfinding sites, will be launched by the federal administration, and North Carolina Department of Health and Human Services has stated that they're also expecting to update their treatment locator to designate test to treat on their locator. So as people look at their treatment locator, it will designate spots as test to treat versus just having treatment. And in closing, here are a few things to remember. It's really important for everyone to evaluate their level of risk and consider additional precautions based on that risk that you have. Be aware of symptoms and exposure to those with COVID-19. If exposed or if symptoms present, consider getting tested at a community site, at a medical provider site, or an at-home test. If you are positive and or you are having symptoms, stay at home and wear a mask when you are around people. And if you are at high risk for severe illness, talk to your provider about treatment. I've put the website up there for the treatment locator that DHHS has, and consider getting the vaccine dose that you are missing today. So thank you so much for the time, and be happy to answer any questions.